I'm Becky Pearson with Pearson Physical Therapy, and we are talking today about physical therapy after surgery. There are a lot of different surgeries that patients can have that do require physical therapy. Most often you think of like a total knee replacement or an ACL repair or a rotator cuff repair. If you do make the commitment to having surgery, you need to make the commitment to your rehab afterwards. We've had some people that have went through a total knee replacement. Maybe they do a couple visits of physical therapy and then they decide that, hey, they've had enough. They can do the stuff that they want to do, but they don't have full range of motion or they don't have full strength. And it is really important to be able to get full range of motion and also to get that knee completely straight. And the reason those two factors are so important is that if you don't get 120 degrees of bend, you will never be able to walk down your steps 1 foot right after the other. You will always have to go 1 foot at a time. And if you never get your knee completely straight, then you will always walk with a limp. You're setting yourself up for further pain down the road, whether it's further pain in your knee or further pain in your back. So it is really important to commit to the rehab afterwards as well as the surgery. Some of the other surgeries that we've noticed that maybe don't get therapy ordered as often are a total hip replacement, where we feel like it is important to get those muscles stronger after you've had surgery. Sometimes the surgeon probably feels like you're walking well and so maybe doesn't necessarily see a need for it, but there can be some pain afterwards, or maybe you still limp a little bit. If we did more strengthening, we definitely could improve your quality of your gait, which should also help decrease pain. Sometimes there's still inflammation in the area after surgery, and so we can help with that as well. We use modalities, meaning like electrical stimulation, ultrasound, can all help with soft tissue restriction. Maybe your scar is still adhered down. We can also do a lot of soft tissue work. Dry needling is something that is also beneficial. Even if it's years after the surgery and your scar is still adhered down, that can be very beneficial in improving your mobility. It is so important to regain your function. Obviously, the reason why you went for surgery is to be able to get back to doing those things that you want to be able to do. When people have shoulder surgery and the doctor wants you to start within a day or two, and we've had some people that delay that because maybe they think, well, I'm going to be really sore, or it's just not as convenient to go in right away. It is very important to start when your doctor says he wants you to start, because depending on what they did in there, if they did a manipulation on your shoulder, you do need to keep that range of motion. And if you sit then for 3, 4, 5 days without moving it, you really aren't gaining anything, and you just went through that whole procedure for almost nothing. If your doctor says, I want you to start therapy the day after your procedure, then make sure that you are getting in the day after your procedure. There are times when you go through surgery and your doctor does not order physical therapy, and I get this a lot where people will ask me, well, should I have had physical therapy? And my feeling on this is if you still have limitations in range of motion or you're still having pain, then do please ask your physician if you could go to physical therapy, because oftentimes they may not realize that you still have limitations, or maybe they don't realize how much it affects what you do throughout your day. Many of us can't make ourselves do the things that we need to do to get that range of motion back. And that's why we're here as physical therapists. We help you through that process. We teach you little things that you could do throughout the day to stretch that joint to where it needs to be, or to stretch those muscles, or how to strengthen those muscles. And so common things that I see that with are like carpal tunnel release. Sometimes it'll be a post-op arthroscopic knee surgery that they don't order therapy for. Just some of those little things that may not take very many sessions to get you on the right track, but it will help you get back to doing the things that you love a little bit quicker.